Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television. We're reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Exactly 2 weeks ago, Covid-19 vaccines arrived in Nigeria. And in the past couple of weeks, the president of Nigeria, Muhammadu Buhari, the vice president, the secretary to the government of the federation, who is also the chairman of the presidential task force on COVID-19, members of the task force, a good number of health workers and other frontline workers have been receiving these vaccines. And of course, it's close to 4 million doses that arrived, grossly inadequate for the population of our country, but with a lot of hope that many more doses is still going to be brought into the country and administered as Nigeria, Africa, and other countries around the world are working towards achieving herd immunity in tackling the most devastating pandemic we've had in the recent history. So, but despite the assurances from experts, government officials, scientists, and a whole lot of other persons, there is still significant doubt among the populace about the efficacy of these vaccines. So because of this, we felt it's very imperative to have an edition of this program to talk about the science of COVID-19 vaccines, how it works, and of course, why it should be trusted by the population, especially given that many high-profile officials and health workers, even many state governors, have already taken this. So on the program today, I have a public health physician who is going to join to tell us why this vaccine works, why it's effective, and we also need to know whether we should still keep using face masks and other non-pharmaceutical measures to controlling COVID-19. He's also going to talk about the emergency preparedness and response, not just towards COVID-19, but also other public health potential emergencies. How well is Nigeria prepared to respond to them should any other epidemic or pandemic present itself in the near future? So I'm going to be introducing my guests after this break, but please do follow us on our social media handles displayed on your screen. And you may also follow me on Twitter at DonLaz4You. And also feel free to subscribe to our YouTube channels if you are yet to do so. Ask questions, send comments, both during and after the program. I'm going to see you again after this short break. Do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital, Abuja. Yes, I have joining me via Zoom a public health physician who has been working in close collaboration, providing technical assistance to the government of Nigeria, the National Center for Disease Control, the National Primary Healthcare Development Agency since last year, and trying to control COVID-19. Dr. Chijioke Kaduru is joining me on the program via Zoom. You're welcome to the program, Dr. Chijioke Kaduru.
Thank you very much, Dr. Laz, and good morning, good afternoon, Nigerians, wherever you may be.
Yes, it's evening here in Nigeria, but of course, different times for other persons watching from different parts of the world. Yes, Dr. Kaduru, can you share briefly what it's been like working on the COVID-19 and the response that Nigeria has been providing in the past, in the several months that, just about a year that have been working seriously towards containing this pandemic?
Well, I think it has been a very interesting experience providing support across different levels of government in the COVID-19 response. I think that for me, there are two very distinct sides of this support and of the work that has been going on in containing COVID-19, and also now in terms of just introducing the vaccines across the country. I think that the most important part for me has to be the fact that the response has been driven by data and science, and there's been minimal political interference in how the response has been rolled out and how effective it has been. And that's something that is commendable, for us as a country, and for how well we have done with that. I think that the other side of it, however, is that, the COVID-19 outbreak across Nigeria has sort of unpacked our health system even more strongly, and has understated the need for us to deliberately invest in strengthening our health system. Because really, all of the work that has gone into the health system over the years, what we have seen with COVID-19 outbreak is that, we've seen that unpack and be unbundled, and it's shown that there's so much more that we can do, to strengthen our health
Our
system.
health
I think that's
system,
a very
yes.
important aspects of the response that have been there for me.
All right, thank you very much. Yes, we're still going to talk about how we can leverage on COVID-19 to strengthen our health system. Given the past 2 weeks, what has been ongoing in the area of the vaccination, why should Nigerians care about COVID-19 vaccines?
Well, look, Dr. Laz, COVID-19 has had a devastating impact globally, right? And even coming down home here in Nigeria, over 2,000 mothers, fathers, brothers, sisters, sons, and daughters have died due to this outbreak in Nigeria. Now, we also know that millions of people have lost their income due to some of the restrictive measures the government needed to put in place, to safeguard the health of all Nigerians from the virus, right? So whether you felt the impact of the pandemic, economically, or you felt, the impact, on your health as an individual, these vaccines are the only way to end the spread of COVID-19 and get Nigeria's economy and our way of life back on track. And so that's something that, that really concerns every single one of us.
Okay, so are these vaccines safe and effective?
Yes, COVID-19 vaccines are safe and effective, right? The vaccines were evaluated in tens of thousands of participants in clinical trials. The vaccines have been approved by the World Health Organization, and currently over 50 million people have received COVID-19 vaccines, right? In over 50 countries around the world. Now, as the lead regulatory agency in Nigeria, NAFDAC has not just provided technical guidelines and rigorous scientific standards to guarantee the vaccine safety, but they've also certified for use all the vaccines that are currently in the country for COVID-19. Of course, this also applies to other vaccines as well, but our focus at the moment is on the COVID-19 vaccines. Now, there are also very intense vaccine safety monitoring systems that have been established in the country, and this is leveraging some of the work that NAFDAC has already done over the last year with what they call the Med Safety application that is for pharmacovigilance, but is also being used to monitor, the COVID-19 vaccine across the country. So for me, what is important to emphasize is that the vaccines are safe and effective because they've gone through rigorous scientific processes.
So have you had this vaccine yourself?
So yes, I received my vaccine shot last Tuesday. And for me, I didn't have any of the mild side effects that some have reported. I'm fine, I'm hale and healthy, and I'm quite excited to have received the vaccines. And I can't wait for all Nigerians who are eligible to have been able to receive the vaccines.
Okay, that sounds good. At least you are speaking from experience, because I'm sure anybody that is watching will be wondering, has this guy had the vaccine? So far in Nigeria, has there been, the previous week there were some unverified reports in some media channels about some European countries having to suspend temporarily the use of a batch of a vaccine that is suspected, to have some side effects. So far in Nigeria, what has been our experience like? Has there been any report so far from anyone about this vaccine?
So, I think I'm going to start off by mentioning that vaccines, like any other drugs, have some mild side effects that anybody who receives them should expect. And in the case of vaccines particularly, it's not surprising for someone to have a mild fever, headaches, generalized body pains. The reality is that this is evidence that the vaccine is working, because what is happening then is that it's causing your body immune system to react and produce the antibodies that will then protect you eventually if you come in contact with the virus. So it's not unusual to see reports of people complaining about headaches, about body weaknesses, about needing to take a day off to rest after receiving the vaccines. For us, I don't think that's something unusual at all. Okay. But again, what's important is that there is now a country system in place to monitor these reports, and there's also support for health facilities should there be any serious side effect. But again, we know that with all vaccines, right, serious side effects happen to maybe 1 out of 1 million people. So that's again not something to worry about.
Okay, so in other words, we are good, just like polio vaccines and so many other vaccines we've been taking to support our body system. So what steps do we need to ensure that it's a smooth rollout, especially when we get more vaccines and we target the general population? What steps as a public health physician do you think the country, both at the federal, subnational levels, need to take to ensure a smooth rollout?
Right. So a lot of work has already gone into, assessing and strengthening the cold chain storage systems, right, in preparation for the arrival of these vaccines. Now, almost every state has confirmed that they have now received an allocation, their own allocation of the COVID-19 vaccines, right, coming from this first batch of vaccines. Now, states have also reported that they've successfully completed the training of the health workers that are going to administer these vaccines, that are going to, support and monitor patient and clients in case there are any side effects or anything of that nature. And we also know that a lot of states are reporting that they've been engaging with communities and communicating publicly and transparently about the vaccines, right? So all of these things are key to ensuring a smooth rollout. Ultimately, however, the COVID-19 outbreak, like I mentioned before, and the rollout of these vaccines, they just really underscore the importance of investing in Nigeria's health system, in our epidemic preparedness infrastructure, in our primary healthcare systems, right? Because ultimately, you can never outperform your health system, right?
Yes.
So all of
sorry, let me cut you. I would like you to speak a bit further on the epidemic preparedness infrastructure. What does it entail?
So I think that when we're looking at the epidemic preparedness infrastructure, some of the things that we have to look at is, for instance, are there already systems in place to coordinate what we would look at as a whole of society response? So, for instance, when the COVID-19 outbreak started in Nigeria, the Emergency Operating Center was activated, right? And what this does is it allows all the different partners and stakeholders and people who have a role to play at every level of this response to be brought to the table to engage in planning, in rolling out interventions, in monitoring those interventions, right? So we need to have the system in place, not just at national level, but at subnational, at local government levels as well, not just the states, to be able to quickly mobilize people and resources to coordinate these kinds of responses. That's a key infrastructure. We know that the infrastructure for this is already available at national level and in all the states, but we also have to make sure that this is available at the local government level, because that's where health systems are really operational, right? Because we cannot coordinate things from national alone. We need the local government team to be in place to be able to drive all of this kind of work, right? And also speaking to coordinating mechanisms. We also need to have systems in place to get supplies, commodities down to the last mile, right? And those systems can be built in the middle of an outbreak, right? We need to make sure that they're in place already, so that when we have any outbreak, and COVID-19 may be a unique outbreak because of the global nature and the pandemic that it is, but we've been having yellow fever outbreaks, meningitis outbreaks, measles outbreaks at smaller scale at the local government level, right? And these are the systems that need drones to managing some of those outbreaks, right? And we also need human resource capacity and to be able to, get people in as sort of a search capacity to make things happen. Right. And of course, you can't discuss an epidemic infrastructure without talking about the money and the resources, the financial resources that we have to meet to making these things happen. Like when they are not in place, we're ultimately just, running around in circles and trying to really make things happen as quickly as possible. But these are things that we should already put in place, because we know that these outbreaks are always going to be there with us. They're here to stay, right? Yes. So it may be COVID-19 today, but it will be Spanish influenza tomorrow, or it could be
and it could actually be any kind of other emerging diseases. And what I get from what you're saying is we need to leverage on this COVID-19 pandemic to strengthen our healthcare system and also the emergency response to any other potential public health emergency that can come around. So let me also add that there is need for the world health systems, at the community levels and the primary health care. So just before we take a break, let me ask you another question. How is it possible that COVID-19 vaccines came up, was produced under a year, compared to many other health conditions or public health emergencies that it takes many years to find a vaccine? So what's special about this virus that made it possible for us to get this solution so quickly? Of course, the world needed it, but many persons might be wondering, what's the magic? Yeah, proceed, please.
So you yourself said it, the world needed a COVID-19 vaccine, right? And that, ultimately is a game changer in itself, right? But I mean, let's just look through all of the systems that are involved. Researchers were not starting from scratch when they learned about the SARS-CoV-2, which is the virus that is responsible for coming for the COVID, right? It's a member of an already familiar, I mean, coronavirus family of viruses, right? And that's something that already is important. So researchers could hit the ground running because they were familiar with the virus. Now, we also know that globally, we have a lot of advances in what we call genomic sequencing, right? So when the first reports of pneumonia cases in Wuhan, China were reported, within 10 days of those original reports, there was available a viral sequence, right, for that virus. And the vaccines are made to respond to the template from the viral sequences. So we already had that within 10 days of this virus coming, right? Now, I mean, something that is not typical with vaccine searches or vaccine research is about steps being done in parallel. But what we saw with the COVID-19 vaccine is that multiple steps were happening in parallel in different places at different times, right? And so that ultimately shortens the timeline. So what we would have typically seen is that you round up one process, maybe it fails, then you try the next process, and on and on. But in this case, we had all of these processes running in parallel in multiple locations, right?
So working simultaneously, you could say that there is a lot of efforts by scientists working simultaneously to find solution as quickly as possible.
Exactly, right? And it's also important to talk about the clinical trial networks, right? So usually, again, what would happen is that it can take you up to 2 years to recruit people for a clinical trial for a vaccine, right? But in the case of the COVID vaccine, what happened was that people leveraged on existing clinical trial networks, and very quickly people were mobilized, and we could, roll out the vaccine research.
Okay.
Across board, right? So across board. And the huge investment in terms of finances, right, meant that we could recruit scientists from multiple locations. I mean, just to get the work done as much as possible. And again, let's not underestimate how important those are to shortening the time frame for the research around the vaccine.
Yeah, thank you very much, Dr. Kaduru. We'll take a break. Well, I must add that for a vaccine that caused a total shutdown of the global economy for months, kind of deserved all the emergencies and the responses that it got. So let's take a break. And when we return, I'll be asking you about non-pharmaceutical responses and control measures towards this virus, whether it should continue since vaccination has started. Do stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. I've been discussing COVID-19 vaccines, how it works, why it's important, and why it should be embraced with a public health physician, Dr. Chijioke Kaduru, who has been providing technical support to both NCDC and National Primary Healthcare Development Agency in the Nigeria's response to this pandemic. Welcome back, Dr. Kaduru.
Thank you very much, Dr. Laz.
Okay, so let's take it up. Is this vaccination a substitute to wearing face mask, all the non-pharmaceutical control measures, regular hand washing, physical distancing, and all of that? So if anyone takes this vaccine, like you did last week, should the person just throw away the mask and forget about all the other control measures?
So I have to say a very resounding no to that, right? So even after people have received these vaccines, it is important to continue to wear a face mask over your nose and mouth. It is important to continue to practice hand hygiene, wash your hands under soap and running water as frequently as possible. And where you don't have running water, use your hand sanitizers. And try as much as possible to maintain a physical distance where possible, avoid large gatherings as well, and also keep the environments that we're in clean surfaces as well, just so that we don't continue to spread the infection. Now, I think it's just important to, talk about some of the science behind this, right? So the realities are that, vaccines interrupt infections in multiple places, right? So a vaccine might be able to stop you from getting an infection or from, being able to give somebody else an infection. On the other hand, a vaccine may be able to stop your infection from progressing to a disease. So you might get infected with the virus, but what a vaccine might do for you would be to stop that from becoming an actual disease, like an actual illness, right? But even more importantly, most vaccines that we have protect you from getting severe forms of the disease, right? The kind of forms that will require you to be admitted in a hospital, maybe for you to need oxygen supplementation or, intensive care, and also prevent you from dying, right? So you know that most of the research around the COVID-19 vaccine focused on preventing people from having severe forms of the illness, all right, and also preventing people from getting hospitalized and people from dying, right? So most importantly, even if you get the vaccine, it's still important to continue to practice all of those, preventive measures that we've been advised to practice until we have large proportions of our population protected in what we call herd immunity. It's important for everyone to continue to abide by those recommended guidelines.
Okay, yeah, I think we got a question from one of the viewers who is asking, with these vaccines, given the mutation of these viruses, given that mutation, would these vaccines still be effective if we start having new strains of the virus? How effective will the current one we are using still be?
So I think, again, it keys back to the conversation around, continuing to abide by the guidelines, right? So the typical with viruses, the more people that they infect, the more there's likelihood of a mutation and some changes, right? And there's this continuous research going on how, those mutations are affecting the effectiveness of the vaccines. What is important for us is that in every country, you have to use what we call the epidemiological data of the outbreak in your country. Okay. So, when we talk about these mutations, how many people in Nigeria who have had COVID are having those variants mutated strains contributing to the burden of the nation or the disease in Nigeria? That also affects the conversation, right, around the effectiveness of the vaccines, right? But the key thing is that the vaccines that we have right now in the country are effective against the strains of the virus that we have. And it's also why everyone who's eligible for the vaccine has to come out and get it, so that we can interrupt the community spread of this virus as soon as possible and ultimately get us to ending the outbreak.
All right, thanks for that response. What can Nigerians do to support the COVID-19 response? You've said some of them in the course of your response, but what more do we need to do as a people or anybody watching this program?
So I think I'll probably just highlight on 3 key things that Nigerians have to do. So the first thing is comply with all the recommended guidelines around wearing your face mask over your nose and mouth, practicing hand hygiene, washing your hands with running water, using a hand sanitizer, trying to maintain a distance, avoiding large gatherings, and also keeping environments and the This is something that Nigerians can do. A second thing that Nigerians can do is to try to get vaccinated as soon as your group is eligible for vaccination. So if you're a health worker, please register and go and get vaccinated. If you're a frontline worker, your turn is next. Please register and go and get vaccinated. If you're above 50 years of age, please register when it's your turn, go and get vaccinated, and on for all the different groups until we can achieve herd immunity. That's the second key thing that we need to have Nigerians do. All right. And I think that the third key piece is for us to recognize that responding to COVID-19 is a matter of nationalism for us as a country and as a people, as well as of patriotism, even though global solidarity is a key part of the conversation. So what that means in essence is that as a Nigerian, you have to take seriously the recommendations of government around the measures that are there, that have been put in place, right?
All right. Dr. Kaduru, sorry, I have to call you. I have 2 remaining questions for you, and I think we have just about 2-3 minutes to round up the program. But I think your point is very well made. I'd like us to quickly look at the emergency preparedness and response system. We talked about it a bit at the beginning, but let's kind of deep dive more into it. How can we strengthen this system in more specific terms? You know that in generally emergency response, you have the mitigation, the preparedness, the response, and the recovery phase. So right now, that of mitigation, we all know that we didn't do quite well in that. Preparedness, is neither here nor there. We are now responding, but we also have to prepare for the recovery phase and keep, the mitigation phase, which is a continuous thing at the end of every response. So how can we make this stronger, especially at the subnational levels?
So I think that, for us, for all of us as Nigerians, Nigerians, right? This is an opportunity to hold government accountable, especially at the subnational level, right? We have to have clarity on government investment in some of the mitigation areas. So, for instance, we have to look into how our government is strengthening communications and community involvement in, planning health service delivery and, monitoring and evaluating that the health system delivers services to people that need them. We have to pay attention to our primary healthcare systems and how government at state and local government level are investing in those systems, because those all contribute to a mitigation ultimately of outbreaks of this nature, right? So we have to pay key attention to those issues. And now that we're looking into the recovery phase, we have to look at key things like identification systems. I know we've had some challenges with the census in the past. We've had challenges with, national identification systems. Government needs to invest in those systems, because those systems create a platform for what we would call social safety nets, right? So, for instance, the government of Nigeria decided that they would like to credit 20,000 naira to every Nigerian who's below the poverty line, right? What identification system do we have in place to make sure that happens transparently and effectively as part of the recovery phase, right? So these things that need to happen, and that we need to hold government accountable to make sure that they're happening. Because ultimately,
we need to hold government accountable. But the private sector, do you see any role? Many of them put in resources last year towards COVID-19 control. How do we make all these huge investments, both from the government and the private sector, count in supporting our health system? Any thoughts in a few seconds? Especially from the private sector
so again,
perspective.
Key investment. Yeah, so we've had key investments from the private sector, right, that have been critical to, going just beyond the COVID response to strengthening our health system, right? We've seen private sector investment in all the governance mechanisms that are coordinating this response and even coordinating the introduction of the vaccine, right? We've seen private sector involvement in delivering of services through the diagnostic laboratories that have been put in place and through, strengthening the diagnostic capacity of states across board, right? We've seen private sector support as well as government investments in training human resources to be ready for the response, as well as rolling out the information systems, both for SOMAS, for the outbreak monitoring, but also for the vaccine electronic system. But again,
Dr. Kaduru, thank you very much. And thank you very much, our viewers from anywhere you are watching from. That's the much we can take today based on how much our time could allow. I believe that you must have learned a lot about COVID-19 vaccines. The conclusion is safe, is effective, and there's no cause for alarm, at least from my experience in Nigeria. So thanks. Let's keep watching this program, and let me see you again next week. And keep following us on our social media handles and making contributions and asking questions. My name is Dr. Laz Eze. See you same station, same time next week. Bye for now.